It snowed pretty hard yesterday and I got lots of cancellation during work, which is not necessarily a bad thing. It's kind of nice every once in a while to get to go home early. Thursdays are my day offs and it's also usually the day I make these videos. So I'm gonna head out to Walmart to get some toothpaste for the thumbnail for this video. This video is called the Toothpaste Guide. So slushy. Should have worn different shoes. So in this video, I'm gonna be going over 3 main factors to consider when it comes to selecting or using toothpaste. I'll be going over some peer-reviewed journals, meta-analysis, and kind of combine them with my clinical experience to help you select the right toothpaste. Walmart is pretty strict on no filming inside, so I'm gonna try to be discreet. Let's pick a few different ones for the thumbnail. Crest, let's get a Sensodyne. Colgate, let's try Gum Restore. We'll get it too. So for toothpaste, you're really looking for one main ingredient. Do you know what the most important ingredient in a toothpaste is?
Fluoride.
Fluoride?
Fluoride. According to an article from the Journal of Oral Health, the use of fluoride toothpaste to reduce caries in children and adults is strongly based on evidence. It's dependent on a concentration minimum of 1,000 parts per million fluoride and the frequency of 2 times a day or higher. When your teeth are exposed to fluoride, your teeth basically absorbs the fluoride ion, making the teeth more resistant to getting cavities. Some parents are worried that their kids will swallow the toothpaste and therefore kind of ingest too much fluoride, which can cause fluorosis of the teeth. Our current understanding is that there is no evidence that fluoride toothpaste use should be postponed until the age of 3 or 4 or older. In fact, low fluoride toothpaste is found to be significantly less effective than conventional fluoride toothpaste. A meta-analysis from the European Archives of Pediatric Dentistry shows the daily use of fluoride toothpaste has a significant caries preventative effect. The use of adult toothpaste in very young children seem to increase the risk for mild dental fluorosis in low caries communities with fluoridated water. So the bottom line and kind of what all these research basically recommend is that for most adults and most children, you should be using a toothpaste with a fluoride concentration of 1,000 parts per million. For young children with low caries risk, that means they're not prone to cavity, and if they're also living in an area with fluoridated water, then you may consider using a lower concentration of fluoride. Adults with high caries risk, we actually recommend using a high concentration fluoride toothpaste with a 5,000 parts per million fluoride. In many provinces or states, they require a prescription from your dentist. So if you're one of those people that kind of gets cavity every time you go in to see the dentist, you can probably ask your dentist about prescribing you with these high concentration fluoride toothpaste. Most big brands have a fluoride concentration of 1,000 parts per million or higher. But if you're using something more niche, like a weirder brand or a smaller brand, then you kind of want to watch out for how much fluoride they have. Alright, so let's put these toothpaste aside for a moment. And I need to fix the propeller on the drone. As you can see, the propeller is broken because when I went to Blaine, Washington, I tried to fly the drone from the balcony into the Airbnb we were staying in, and I kind of crashed the drone doing that. Lesson learned: if you fly a drone into a building and crash it, fly into more buildings so you get better at it. So luckily I got some spare. This one's kind of cracked too.
When I get in, I take a shower, read a book and feel empowered. Smoking on that sour got me counting down the hours, thinking of all the shit that they could do but won't allow us. Then I realized they also...
Let's go over the second important consideration when you're choosing a toothpaste. If you have sensitive teeth, you want to look for a toothpaste that has desensitizing chemicals in them. 2 of the most commonly used desensitizing agent in toothpaste is stannous fluoride and potassium nitrate. Dentin is porous. Dentin's got these little tiny holes called dentin tubules, and these holes connect to the tooth nerve. So what these desensitizing chemicals do is they basically get into these dentinal tubules and blocks the tubules. So it plugs up the holes to make the teeth less sensitive to any kind of disturbance from the outside. What type of toothpaste should you avoid using if you have sensitive teeth? A is fluoride-free toothpaste, B, activated charcoal toothpaste, C, whitening toothpaste, and D, all of the above.
All of the above.
If you have sensitive teeth, you want to avoid using any whitening products, as whitening products will tend to make your teeth more sensitive. Some toothpastes are marketed as both whitening and desensitizing. Since whitening products tend to make the teeth more sensitive, if your goal is to decrease the sensitivity, then you don't want to use those toothpaste as they're kind of counterproductive. Alright, so I'm gonna try it out inside first, and if it works okay, then I'll take it outside in a bit. You don't get too many opportunities on snowy sceneries in Vancouver. There we go. Hope it doesn't hit me. Nice. It's working. Oh yeah, and the last point I wanted to say about the toothpaste is the time and frequency. How much toothpaste should you use? The American Dental Association recommends brushing twice a day for 2 minutes each using a pea-sized amount of toothpaste. So yeah, hope this information helps, and I'll see you guys next time.